There are two sides to the story, the bad side and the good side. The bad side's pretty bad, but needs to be told so that people can better understand this silent but deadly disease. So I'll begin with the bad side, but as I go through it, understand that there's a good side too, which I'll get to at the end of the video. In a situation where an individual is chronically consuming too many calories, eating too many unhealthy foods, such as too much processed food, fried food, fast food, and snacks, and not meeting the minimum guidelines for aerobic and strength exercise. What happens is that it makes their digestive system unhappy because it has to work overtime to digest foods that aren't healthy, lack adequate nutrition, and have a negative effect on gut health over time, when it would rather be fed fruits, veggies, lean meats, healthy grains and fats, and water. It makes the circulatory system unhappy because the blood is becoming more viscous since it has too much crap floating around in it, too much fat, sugar, insulin, etc. This is creating excessive shear force on the interior walls, which causes damage and leads to plaque buildup, which then causes narrowing of the vessels and increased blood pressure. Even worse, in very small capillaries which have a very small diameter, such as capillaries in the eyes, feet, and kidneys, this plaque buildup and increased pressure can cause damage to organs. All of this makes the heart unhappy because the heart wants to exercise and get stronger, but because it isn't being exercised enough, it gets weaker instead. Yet it has to pump increasingly viscous blood through a damaged, weakened circulatory system, which is harder for it to do. And it makes the pancreas unhappy because every time the person eats, the pancreas is being stimulated to secrete insulin because it wants to deliver the fat, protein, and carbs to the cells that need it, especially muscle cells, and it's having to work overtime and is becoming damaged. And finally, it makes the muscles unhappy because they also want to be exercised, but they aren't. And because of that, they're getting weaker, becoming atrophied, and have increasing intramuscular fat storage, which is causing them to become less efficient at their function and also increases the risk of injury. On the surface of muscle cells, there are insulin receptors, and in a normal exercising environment, these receptors have an affinity or love for insulin because they want the insulin to deliver carbs and fat as fuel so they can eat it up and use it. But because in this bad side of the story, they aren't being exercised, they develop a resistance or hatred for insulin. They're sick of seeing insulin deliver fuel all the time because they don't need the fuel. So they're basically saying to insulin, get lost, we aren't exercising, so we don't need you anymore. And what happens in this type of situation is that over the course of about 7 to 12 years, the person goes from having normal blood sugar to being pre-diabetic to being diabetic. By the time they're diagnosed as diabetic, they've lost the function of about 50% of the beta cells in their pancreas, have doubled the risk of having a heart attack, and will have to incur the cost of medications and the inconvenience of having to monitor their blood sugar every day. So the bad side of the story is pretty bad, but there's a good side to the story. If we set eating habits to the side for a second and just focus on exercise, and starting with the muscles, when you exercise, and especially when your exercise program is progressive and includes occasional vigorous intensity exercise, it makes your muscles happy because now they're doing what they were meant to do. And literally, as soon as you start exercising with adequate intensity, your insulin receptors start to redevelop an affinity or love for insulin because they want and need the fuel that insulin is trying to deliver. Along with that, exercise activates some receptors that hang out inside the cells called GLUT4 receptors, which perform a similar function. They migrate to the surface and basically suck the circulating fat and sugar into the cell because the muscles don't have the time to wait for insulin to deliver all of the food. The muscles need fuel right away. And the exercise is making muscles stronger and more vibrant. The pancreas is happier because the insulin it's secreting is actually being utilized and the pancreas is no longer being damaged. Another cool thing is that the positive effects that exercise has on insulin sensitivity can last for about 48 hours, which means that if you're exercising every other day, these effects won't disappear. This is why exercise can reverse insulin resistance and resensitize the insulin receptors. The circulatory system is happier because the excessive fat, sugar, and insulin is now being utilized, so the blood is becoming less viscous. Another benefit of exercise is that it increases the good cholesterol, called HDL. A primary function of HDL is that it's literally an army cruising through your circulatory system looking for plaque to eat up. Exercise is helping to repair your damaged circulatory system. All of this can help decrease high blood pressure as well. This then makes the heart happier because not only is it exercising and getting stronger, but it doesn't have to work as hard to pump blood through the circulatory system since it's now less damaged and less viscous. And all of this can have a positive effect on the digestive system because it improves gut health and because exercise and diet typically go hand in hand. People will naturally start eating better because they don't want to sabotage what the exercise is doing, and exercise can reduce the effect of your hunger hormones, which will lead to eating less calories and the associated weight loss. So hopefully now you have a better understanding as to why diabetes can be a silent killer and is so dangerous, and the importance of exercise in reversing the negative effects. If you liked the video and enjoy this type of content, please hit the like button and subscribe to my channel. Thanks a lot for watching, and I'll see you in the next one.